So I'll call up our next speakers. So the Be Well Community Collective is a collaboration led by an energetic, innovative trio, including Jennifer McMaster, Health Promotion Specialist at the Georgian Bay Family Health Team. She has a Master's of Health Promotion, registered kinesiologist. Fiona Proctor, a public health nurse in Simcoe, Muskoka District Health Unit. She's an RN. And Jennifer Parker, local project manager, Healthy Kids Community Challenge, Collingwood, has a Master's of Public Health and Master's of Education. And drawing on their professional experiences in the field of public health, primary care, and health promotion, the Be Well Community Collective evolved, guided by the Ottawa Charter, to strengthen community action, create supportive environments, develop personal skills, reorient the health system, and work toward building healthy public policy. Their work is informed by the social determinants of health, evidence-based practice, and builds upon existing health messaging, leveraging community resources and services to support individual and organizational practice in multiple settings across South Georgian Bay. Thank you for coming to speak to us today.
Thank you. Can I just take a quick second to invite everybody to their feet and just take a little bit of a movement break? Lots to think about this morning. So if we could just take a second, move your feet, roll your shoulders, take a couple breaths in, get comfortable again. As much for you guys as it is for us and our nerves up here. All right, just take a moment. Very nice. Thank you.
So I'm going to get us started. Much of today is about looking at the interconnectedness between primary care, tertiary care, and all the great things that are happening within our community. And the Be Well Community Collective embodies this idea. So I'll start with setting the context. I work as the local project manager with the town of Collingwood as part of a project called Healthy Kids Community Challenge. I'm going to give you a bit of a snapshot as to what that looks like. And then Jennifer and Fiona will take you through the initiatives that we're introducing as part of the Be Well Community Collective. And Fiona will end with some of our vision statements, mission statement, as well as looking at what's next in the future. So I'm going to use a bit of an example of my day today in terms of describing what's going on in this elaborate and complex diagram. So as the local project manager of Healthy Kids Community Challenge, I'm funded by the Ministry of Health and Long-Term Care. It's a provincial initiative, 3-year initiative. We're guided by overarching themes. We started with a project or a theme called Run, Jump, Play Every Day, moved on to Water Does Wonders, and we're currently looking at Choose to Boost Veggies and Fruit. And so what does that look like for us? We're guided by an amazing steering committee. So we have this fantastic community partnership or foundation already set in place. And that includes the Simcoe Muskoka District Health Unit, Georgian Bay Family Health Team, as well as our school board and many different organizations across the community. All of these community partners work with kids already in part of their everyday actions, that 0 to 12 population that I look at. And we look at delivering programs, building a supportive environment, and creating healthy public policy. So what does that look like on the ground today? I started with the walking school bus. Actually, I started with sporks, and that was involved in the walking school bus. So that meant going to a school. So this is looking at our specific school setting. Going to a school and walking with a group of kids, encouraging them to come with the walking school bus, although there are so many other reasons to do the walking school bus in terms of social connectedness, reducing the amount of traffic around our schools, active transportation, moving, getting going before you get to school, which sets you up for the day. So it started with that. As we sit here, there's a school that's currently at Loblaws, an amazing community partner who's delivering free cooking classes to all of our grade 6 classes or across the school, building those life skills around food and eating. It's going to end at Simcoe County Housing, where we're doing a community garden project with Big Brothers Big Sisters, and then moving on to, and that's that supportive environment piece, and then moving on to one of our schools at a fair, who has adopted the pledge statement around Water Does Wonders, which means that all of their activities, when they're delivering something within their school, they're choosing water first. That water will be the choice because we know that kids consume a huge amount of sugar through sugar-sweetened beverages. So modifying that creating a supportive environment, as well as putting the policies in place to encourage that. We have all kinds of different initiatives, and I welcome you to have a look at our poster outside in the hallway to get a sense of all these different things. Now, in delivering Healthy Kids Community Challenge, we learned of a project that was happening at a BC Children's Hospital, which was specifically focusing in on the primary care setting. And thus, the Be Well Community Collective was born. So looking at how we can deliver different programs, how we can continue with this message, create sustainability, draw upon the foundation that we've already set with Healthy Kids Community Challenge, and specifically focusing in on that primary care setting. And that's what Jennifer and Fiona will talk about. Now, as part of this morning and the many amazing presentations that I've listened to, we've really focused in and had conversations around those social determinants of health. And the social determinants of health are what will guide our practice. We know that there are so many different variables. Health is everywhere, every day. And there are all kinds of things that influence the health of our children and in turn our adults. And this is part of what will inform our practice. And I'll let Jennifer take it from here.
Thank you. Can you click for me? So thank you, Jennifer, for setting the context for this for our presentation. So what can we do to address the social determinants of health and health behaviors to keep people healthy and well in our communities? Well, of course, we go to the evidence and we go to the research. We start there. And by using the Ottawa Charter and the collective impact framework to inform our work, we can strengthen community action, we can help develop personal skills, create supportive environments, reorient health services across a broad range of organizations and the communities of South Georgian Bay. What we do know is the evidence shows us consistently that in order for health promotion and chronic disease prevention to work and be effective with children, all sectors of a community need to be involved in that process. It takes a village to raise a healthy child, and right now we have coordinated efforts in South Georgian Bay across multiple community settings to create environments that support children and their families in addressing the health and well-being. So the Be Well Community Collective leverages the Healthy Kids Community Challenge Steering Committee, the Simcoe Muskoka District Health Unit, the Georgian Bay Family Health Team Resilient Kids Committee, in adopting a whole community approach, supporting the planning, implementation, and eventual evaluation of various initiatives aimed at raising healthy, resilient children. At the moment, we're working on 4 initiatives, supporting the advancement using best practice, promising practice, and evidence-based research. Our first initiative is enabling physicians and allied healthcare professionals to change processes, improve health promotion discussions, maximizing the idea of a primary care provider as an intervention strategy. We also have that one because doctors like when we ask them to change their process. Our second strategy is improving the referral pathways to improve community connection, developing and disseminating a consistent health message across the primary care setting, in the community, in schools, in homes, so that it's a little bit easier to understand and to follow. And our fourth strategy is developing an interactive website where we can house our information, our resources, and local referral resources. So together, these 4 initiatives make up the Be Well Community Toolkit. And I'll talk a little bit more about what each initiative is. So the first one is the implementation of a screening tool. And what we do know there is that healthcare professionals directly impact children's health. Every interaction is an opportunity to address and reinforce the importance of healthy choices that we make every day, supported through adequate income, positive parenting, and mental health. And according to Scope and the BC's Children's Hospital, providers have this unique opportunity to emphasize the links between the lifestyle choices they make and health when meeting with patients and children. So we have modified a healthy habits questionnaire that was based on existing evidence and best practice, which allows physicians to assess lifestyle choices and facilitate respectful conversations with parents and children when they're meeting with them. without the stigmatization of subjective selection of families for local programs and services. Also using motivational interviewing, it provides the opportunity to have rapport building, active listening, and therefore getting down into a little bit more about what health means for the individual patients, the children that they're seeing. And by encouraging patients to complete the healthy behaviors survey annually, we're hoping that physicians can be alerted to clinical red flags ahead of time before they get out of hand, and ask about social challenges in a sensitive and caring fashion. Our second initiative is aimed at improving the patient's connection with community resources and referral pathways. We have a lot of great resources in the community. It's not always easy to get a patient or a family from an office into those support networks. So we're hoping to make that a little bit more efficient, a little bit more effective. And again, also highlighting that the whole community has a responsibility and plays a role in raising healthy, well children. So our third initiative is to disseminate a consistent evidence-based health message across and within the community. The healthy behavior messaging is meant to be easy to understand and to implement throughout your day. So at least 10 hours of sleep is recommended, consuming at least 5 servings of fruits and vegetables a day, aiming to have about 2 or less hours of recreational screen time, although that can be quite challenging, and to play for at least 1 hour throughout the day with heart-pumping physical activity, and aiming to choose 0 sugar-sweetened beverages when we have the opportunity. For many, though, in our community, and as Jennifer spoke a little bit about the social determinants of health, it's not always the easiest choice to make. The 10-5-2-1-0 health behavior messaging may be something that can be adopted by families who have their basic needs met. However, what we recognize is that there's other resources that have to come into play for those struggling with one or more of the social determinants of health. Therefore, in addition to the consistent messaging of 10-5-2-1-0, the Be Well Community Collective has expanded on previous messaging and acknowledges that positive parenting plays a vital role in a child's ability to thrive. There is no health without mental health, and people require an adequate income in order to live and be able to adopt healthy lifestyle behaviors. And I will turn it over to Fiona to discuss our fourth initiative.
Thank you. Can I have that?
Okay, sure. I'll need that for you.
So our fourth initiative is an interactive website that can be used as a self-directed referring tool in the community or a conversation map led by patients. The website will have an easy-to-navigate interactive resource map with information and connections. And the tool supports the Georgian Bay Family Health Team's purpose to provide patient-centered care and supports the integration of the idea that health happens every day, everywhere in South Georgian Bay. Coincidentally, the Canadian Medical Journal published an article in its February 2017 edition, which highlights the actions that need to be addressed in primary care to support physicians in addressing the social determinants of health. Just to those are the pieces that include the 4 initiatives, and so we went over the toolkit. So that's a healthy habits questionnaire, assessment plus motivational interviewing, enhanced EMR referral pathways, consistent messaging with the interactive website. These are the tools that we will use to work towards enacting our mission and vision. So all of us here today are working towards moving systems, organizations, and policies to accomplish and improve health and wellness. We cannot do it without working in a collective impact framework and by being innovators. As stated by Jennifer P., the stats are rather alarming in regards to the health of the health of children. We need to take an approach grounded in evidence with a touch of promising practice, as the current efforts that we have been employing have yet to curb the rising rates of chronic disease, obesity, mental health, the adverse childhood events which the doctor just spoke about. And so, our common agenda is being driven by our mission. We aim to provide South Georgian Bay with an interconnected system, fun and easy to use tools that cultivate and inspire a community that values health and happiness. And our vision, and it's big, and we're going big, is to revolutionize the way the community of South Georgian Bay eats, moves, and lives to develop healthy bodies, minds, and families in our neighborhoods and beyond. So where do you as community providers fit in? We're looking for screening patients annually, ages 2 to 17, using and promoting the Be Well messaging with the patients within your clinic. We also really would like to engage in a bit of conversation because we're going to need to develop some of these pieces. And so within the piloting of the screening tools with the physicians in the coming months, we need some guidance on how it will work in the doctor's offices. We don't have all the answers in terms of implementation, but inertia isn't a solution either. We want to shed light, not heat, and minimize additional workload while addressing complex issues. In the near future, we're going to be reaching out to the community to assist in developing our referral pathways and enhancing the way our community can provide integrated care in tandem with primary care. When this invitation comes out, or we would encourage you to join the conversation, or if you'd like to be on that list when we do connect with you, please do connect with us afterwards for the poster presentation pieces later on. And we'd love to hear from you. We're open. This is a community collaboration, which means that we cannot do this by the three of us sitting here and going, that might be a good idea. We are using the evidence-based practices, but we need to hear feedback as to whether what we're producing is going to work and if there's going to be ways to increase the effectiveness in which those referral pathways happen and how the community is going to wrap around to work with us. And that's everything. Thank you for your time.